Our first two videos looked at how micronutrients and macronutrients work together to make ATP energy. This video is all about glucose. The fourth video covers which labs you can use to monitor your lifestyle changes, and the last video discusses some more advanced metabolic pathways. Glucose is your mitochondria's favorite fuel, and it's easy to test. In today's video, we'll look at 3 different ways to test glucose and how they give you an extra vital sign to help optimize your lifestyle habits. The first test is your fasting blood glucose, which we use to help calculate your insulin resistance. Insulin resistance is when your heart, liver, and muscle cells become resistant or numb to too much sugar and insulin all the time. This triggers your body to store more and more fat, which has negative health effects. That's why one of our main priming and detox protocols focuses on combining supplements and lifestyle changes to reverse insulin resistance. The second glucose test is your hemoglobin A1C, which we'll do on your follow-up blood test. Hemoglobin A1C uses your red blood cells to estimate your average blood glucose over the last 3 months. This provides excellent accountability because you know your sugars are being tracked over a 3-month time period. It was a breakthrough in glucose technology about 15 years ago and is still super powerful today. But the main test I want to cover in this video is continuous glucose monitoring, or CGM for short. Along with wearables which track your temperature, pulse, and sleeping respirations, the CGM allows anyone to track glucose like another vital sign. And I think all adults, whether you have diabetes or not, should consider wearing a CGM at least annually if you can afford it. The remainder of this video will focus on step-by-step instructions on how to put on and interpret your CGM. 99% of the information from CGMs are interpreted by you, not your doctor. Only you know continuously how you're feeling, what your other wearable data shows, if you're stressed, when you're eating or exercising. As physicians, we can look at trends in your CGM data, but only you will know exactly which lifestyle habits needed to change for you to improve your glucose at that time. So let's get started. These instructions are for the Freestyle Libre 2, where you should first take a shower or wash your arm with soap and water. This minimizes the risk of infection from the tiny flexible filament that measures your glucose for 2 weeks. Then wipe the flat part of your tricep on your non-dominant arm with the alcohol swab. While you wait a minute for it to dry, line up and attach the applicator to the sensor and connect them by pushing on a flat surface. Then push the applicator to your arm, depositing the sensor, throw away the applicator, and you're done. Just download the Libre 2 app, which looks like this, and follow the instructions. You can turn off notifications as long as you're not taking the following diabetic medications: insulin, glycoside, and glyburide, because they can cause low glucose. It'll take an hour for your app to sync with your device, and then you're ready to go. Just glance at the app whenever you want to know your blood glucose. Use the link below to watch our YouTube video on 10 tips on CGMs, but here are a few of the most important things to know. First, watch your blood sugar responses with different meals. It should go up by 2 or 3, and if it's spiking to 4, 5, or 6, then think about what carbohydrates you just ate. And portion size matters a lot. Maybe a big scoop of rice spikes you every time, but a small scoop of rice is okay. The order of eating matters too, starting with your salad, especially a vinaigrette dressing, and then eating a protein and saving most of the carbs for last will also improve your blood glucose response. The 5 roots of social connection, sleep, stress, nutrition, and exercise all influence your blood glucose as well. And finally, consider doing low-grade exercise about 20 minutes after each meal, such as stretching, walking, or resistance bands, and see how it helps your blood glucose. There's so many ways we can monitor glucose to improve our health, and my next video will reveal even more tests you can use to help track your progress with lifestyle changes.